Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Today's section, I take you through another anatomy of clinical importance. Yes, as far as looking at the posterolateral aspects of the thorax, one important triangle that often we encounter is, of course, the auscultatory triangle. Something we can also call the triangle of auscultation. It makes sense. It means that there will be some kind of auscultation which is going to take place there, and I'm going to tell you, okay, which organs we are going to listen to, whichever sound that are going to emerge from these areas. And so, without wasting my time, let's set the ball rolling. Now, so just to show you where this triangle of auscultation is, okay, as I told you in the posterolateral aspects of the thorax, okay, there's a small triangle, okay, over here, which of course, if you cause, this kind of abduction of the scapulae, of the medial borders of the scapulae, or we cause that kind of, protraction of the scapulae, which I'm going to explain to you, then this triangle, okay, this triangular area, yes, will be more prominent over here. Now, first of all, what I want you to understand is for us to appreciate which muscles or which structures are forming the boundary of this, triangle of auscultation. Now, first of all, there's this muscle that we find over here, okay, the one which you find it over here, okay, there's a muscle over here. If you usually hold it, it's very painful over there. Now, that muscle, which of course, where is supplied by, of course, something that we call the spinal accessory branch of the accessory nerve. Yes, that's of course the 11th cranial nerve. This time I'm talking about the spinal accessory nerve. Okay, so that nerve is going to give motor supply to this muscle we are talking about. And which muscle is that? We are talking about the trapezius muscle. That same muscle which forms, yes, one of the boundaries of the triangle of the neck. Yes, of course, it can separate what we call the anterior triangle. Yes, mainly if you're talking about the triangles of the neck, okay, the major boundaries, okay, for the posterior triangle, we're talking about the sternocleidomastoid, and then, of course, we talk about this trapezius muscle. Okay, so what I'm interested in is that I'm not talking about the upper fibers of this trapezius muscle. This time, I am talking about the lower fibers, my friends, the lower fibers of what we call the trapezius muscle. Okay, so that is one thing that I want you to become aware of. Okay, it will be very important in forming, this kind of, superolateral boundary of this triangle of auscultation. That's the first thing. Now, the second thing is that we have this muscle too, which of course, oftentimes I call it the climbing muscle because it helps you to move the, body upwards as you climb anything. Okay, it is also very important as far as extension, okay, at the upper limb, at the shoulder joint is concerned. Yes, not only that, will help in that kind of medial, rotation of what we call the upper limb at this shoulder joint also. That muscle over there, which forms a very bulk area as far as the lower aspect of the back is concerned, is, my friend, something that we call latissimus dorsi. One thing we know about latissimus dorsi is that, yes, it is that muscle whose innervation, yes, is coming from, of course, something we call the thoracodorsal nerve. Okay, now this time around, I'm not talking about the lower fibers of this latissimus dorsi, but my friends, I'm talking about the upper fibers of latissimus dorsi, which will be very important, yes, in contributing to the boundary of this, triangle of auscultation. Okay, at, of course, the inferior, lateral aspects over here. Okay, so that is one thing that we find over here, or the inferior aspects. Yes, we have this, latissimus dorsi. Now, one more thing, which, yes, this time is not a muscle, but my friends, it's a bony prominence, or it's an area of a bone. And my friend, which bone are we talking about? We are talking about the scapula. But my friends, getting to the inferior angle of the scapula, this is the area where we find the triangle of auscultation. So we are talking about the medial border of the scapula, forming the lateral aspect of this triangle of auscultation. Okay, so medial border of the scapula. One thing we know about the medial border of the scapula is that the medial border is known for insertion of muscles. And importantly, as I'm talking about the inferior angle, then you know which muscle I'm talking about over there. The muscle which will be inserting there towards the dorsal aspect is, my friends, something we call the rhomboideus major muscle. Rhomboideus major muscle. So yes, some authors may also include that rhomboideus major muscle will be contributing to, of course, the lateral aspect of this triangle of auscultation. But my friends, mainly we are talking about the bony aspect, and which area we are talking about the middle border of the scapula. Yes, very close to, of course, the inferior angle. So that is one useful thing that I want you to know. Now, then the question that we have to ask ourselves is that, yes, this time around we are looking at anatomy of clinical importance as far as the part behind the voice section, okay, is concerned this time around. And so then what's the point? The point here is that we can use it to, of course, listen to the sounds, okay, that will emanate from, of course, the lungs. So whether it's the left lung or it's the right lung, we can listen to the sounds that will emanate from these areas. Now the question is why? Why is it so that we've chosen this area this area called the triangle of auscultation to be, let me say, the ideal site, okay, for us to listen to the sounds that will emanate from the lungs? My friends, the answer is so simple. The reason is that, yes, you can appreciate that we have this trapezius muscle all over here. That's not the one I'm talking about. I'm not talking about the trapezius, okay? Neither am I talking about this thick muscle which we are calling the latissimus dorsi. Neither are we talking about the muscle which will be attaching to the middle border of the scapula. But this area, which is, of course, something like a small area in between them, this area, okay, is an area where we have minimal muscles around over here. And so because we have minimal muscles around over here, then there's minimal impedance to the sounds that will emanate from the lungs, so that we can easily listen to, of course, the sounds that will emanate from, of course, the lungs. Okay, so that is one important thing which I want you to know. Now, this triangle of auscultation can be manipulated so that it becomes larger enough so that we can listen to more sounds. And how do we do that? Now, it's by way of manipulating the medial border of the scapula. And so how do we manipulate the medial border of the scapula? Now look at the position of the medial border of the scapula over here. And so what I can do is that if I cause what we call protraction, okay, if I cause protraction of the scapula, and which muscle is going to help you as far as protraction of the scapula is concerned? That muscle, which is also very important in maintaining the medial border of the scapula to the thoracic wall, to the ribs. And which muscle is that? My friends, you know, that muscle is that muscle which, of course, which will be inserting to, of course, the ventral aspect of the medial border of the scapula. And my friend, that guy is something we also call the boxer's muscle, serratus anterior muscle. Something we also call the big swing muscle. Now, if you give a big swing, what are you doing? You are causing protraction of the scapula so that the medial borders of the scapula, yes, will become more abducted. And so when it goes this way, then the triangle which is over here can be enlarged, so that more sounds from the lung can, of course, be perceived. Okay, so that's one useful thing that I want you to become aware of. Now the question is it only for listening to sounds that will emanate from the lungs? My friends, no. Because another application to this triangle of auscultation, yes, the one where is towards the left, okay? So I'm not talking about the right one, I'm talking about the left one. The left one where, of course, in the thoracic region, it will be related to, of course, the the cardiac orifice, okay, of what we call the stomach. You know, that is where the esophagus will be meeting, of course, the stomach at that level. If we also want to, assess that kind of obstruction as far as the esophagus is concerned, we can also, use the left aspect, okay, to listen to it. Now remember that deep to this triangle of auscultation is related to rib number 6 and, of course, rib number 7. It therefore tells me that the intercostal space, okay, that will be captured in there is, of course, the 6th intercostal space. Okay, and we know that in the 6th intercostal space, the neurovasculature, as far as the 6th, nerve, the 6th, the artery, and of course, the intercostal vein are concerned, that is where they are going to run. Okay, so it means that in situations where someone may have fracture of these two ribs, and there's that kind of pain, okay, nostalgia emanating from these, ribs, then what will happen is that we can give a nerve block, okay, to these areas so that the pain becomes minimal. Okay, so that I give it at the level of the 6th intercostal space. And how do we get it? By locating the triangle of auscultation. And so by way of the manipulation to ensure that the area as far as the triangle of auscultation becomes larger, then what do? So oftentimes clinically what you do is that, yes, usually you bend, and of course the upper limb, okay, you take it to the opposite side, okay, this way. So for instance, if it's the right one that we are going to get it, then it becomes more, prominent so that it can be perceived. Now, under what circumstance will, of course, ensuring that this triangle of auscultation becomes larger, becomes impeded? In situations where, for instance, there's an injury to something we call the long thoracic nerve. One thing we know about the long thoracic nerve is that the one which gives motor supply to, of course, the serratus anterior muscle. I told you that the muscle which is very relevant as far as protraction is concerned, yes, is which one? I told you about it, and I said that is the serratus anterior muscle. And so in situations where, of course, there's injury to the long thoracic nerve which supplies serratus anterior muscle, then of course you cannot cause abduction, okay? You cannot cause protraction of the scapulae. And for this reason, you cannot really manipulate the scapulae to get a very large surface area for this, triangle of auscultation. Ladies and gentlemen, I hope you find this meeting helpful. And of course, you are going to get all these concepts, yes? Very clear. In future editions, we'll bring in all these points for you. So I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.